Welcome to Dr. Balga's podcast for the Curious Doc. Today is April 17, 2026. This video is on a New England Journal of Medicine review article published on April 15, 2026, titled Sex Hormone Influences on Venous Thrombotic and Cardiovascular Risk. Do sex hormones increase venous thromboembolism? Yes, via combined effects on coagulation and vasculature. Is the absolute risk high? No. Generally low despite increased relative risk. Key determinants of risk: the dose, the formulation, the route, and patient factors. Is cardiovascular risk multifactorial? Yes, influenced by age, body mass index, and comorbidities. Most important clinical principle: individualized risk benefit decision making. How does estrogen affect coagulation? It increases clotting factors and reduces protein S. What is activated protein C resistance? Reduced anticoagulant response to activated protein C. Do progestogens act independently? They mainly potentiate estrogen effects. What about fibrinolysis? Mixed but net prothrombotic balance. Vascular effects? Estrogen promotes vasodilatation and anti-inflammatory actions. Contraception and depo-progesterone. Combined oral contraceptive venous thromboembolism risk. It's about 3.5-fold higher versus non-use. Absolute risk with combined oral contraceptives, approximately 6 to 16 per 10,000 person-years. Depo-progesterone risk, intermediate, about 2 to 5.7-fold increase. The safest contraceptive option, 11-orgesterol IUD with no increased risk. Do progestin-only pills increase risk? Minimal or no increase. Hormone replacement therapy and gender-affirming hormone therapy. Hormone replacement therapy and VTE risk, 1.4 to 2.4-fold depending on regimen. Oral versus transdermal hormone replacement therapy. Transdermal has minimal venous thromboembolism risk. Gender-affirming hormone therapy venous thromboembolism risk increased, but absolute risk remains low. Highest risk estrogen, ethinyl estradiol. The safest gender-affirming hormone therapy option, transdermal estradiol. High risk and clinical decisions. Major risk factors: age, obesity, smoking, and thrombophilia. Family history effect increases venous thromboembolism risk by 2 to 4-fold. Prior venous thromboembolism management: prefer low-risk hormones or anticoagulation. Perioperative approach: often continue hormones with thromboprophylaxis. The core takeaway of this article: venous thromboembolism risk depends on formulation, timing, and patient risk, all of which determine outcomes. This is a fantastic article in the New England Journal of Medicine. Go ahead and read it. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.